Good morning and thank you for joining us. My name is Sean Paschke with Xcel Energy, the proud premier sponsor of this Eggs and Issues program. I want to take a moment to recognize the important list of additional sponsors who make this event possible. Our program sponsor, Sanford Health, our supporting sponsors, Bremer Bank, Concordia College, Dabbert Custom Homes, First Western Bank and Trust, Home Builders Association of the FM, Moore Engineering, MWC Advertising of Fargo-Moorhead, Roars, Olteg, and Western State Bank. Additionally, we would also like to thank our production sponsor, Livewire. Thank you to those companies for their support of this growing event series. Be sure to use the hashtag FMWFEggs to share information from today and help us further grow this event. Before we get started, we'd like to share a few of the exciting upcoming events the Chamber has. Next week on January 19th, from 8 to 9:30 a.m., the Chamber will host the 2023 State of the Cities at the Delta by Marriott. This annual event will gather mayors from Dilworth, Fargo, Horace, Moorhead, and West Fargo, and address topics such as workforce development and infrastructure. There will also be a Q&A for you to weigh in on topics you care about. Join us for this important event as we keep our city leaders directly connected to our business community. The Midwest Economic Summit will take place on Wednesday, February 8th. This event will bring together several chambers of commerce, industry leaders, policymakers, and economic experts from across the upper Midwest to take part in a holistic, timely, and critical discussion regarding where our regional and national economies are headed and how our businesses can stay agile and respond to this evolving environment. Hear from keynote speakers and panelists from various sectors including ag, energy, healthcare, manufacturing, retail, and technology. Be sure to join us on Thursday, February 23rd for our next Eggs and Issues Facing the Future Together, Energy and Ag. This morning we'll discuss the nexus between, agriculture and energy and finding common ground while facing uncommon challenges. We will dive into the current state of affairs and where we are headed in the future. To learn more about these opportunities and register, please visit the Chamber's website at fmwfchamber.com. As we now jump into today's topic regarding the mental and behavioral health crisis, I would like to welcome Dr. Stephen Wunderlich from Sanford Health to the stage for a brief pre-panel presentation. Following Dr. Wunderlich's presentation, he will be joined on stage by our panel for further discussion. Please welcome Dr. Wunderlich.
Hope I have the clicker. I do. Thank you, Sean. It's a pleasure to be here, and thanks for the opportunity to kind of set the stage for our discussion today. What I want to do is try and talk a little bit about what's mental health in general. Then I want to talk a little bit about mental health in our region. And then I want to talk a little bit about challenges in a rural area like we're in terms of taking care of patients with mental health needs. I'll be quick, to the point, and then we'll get on with the real show. So let's take a minute and talk a little bit about mental health. What is it? Mental health is defined as a state of well-being in which every individual realizes his or her potential, can cope with normal stresses of life, can work fruitfully, and is able to make a contribution to his or her community. Now, it's a high bar. And I got to admit, I don't meet this every day. It kind of goes like this, you know? And so we don't want to impose some unrealistic standard here, but somehow having some sense of satisfaction and being functional in the world is a key. What's mental disorder? Health conditions involving changes in thinking, emotion, and behavior, and it's usually all of them. It's the human condition. It's not working right, and it's along the lines of thinking, feeling, and what I do. And what it does is it creates significant distress and problems in functioning at work, social conditions, and everything else. So it's far-reaching and touches every aspect of what we do, including work. Now, the important thing for anybody who thinks they kind of know what mental health and mental disorders are about, it's really complicated. And all these things, all the psychological things, personality, the way I think, the way I feel, my biology, my genetics, the economic climate in which I live and work, it's really important. Some countries have very different mental disorder rates than other countries, and it's largely because of economics. And then lastly, just biology. It's in the body. And I think one of the things we want to talk about is mental illness is no less a biological problem than cancer. And that's something we really have to think about, and we'll get to stigma, and we need to somehow think this is something that has real legitimacy and needs treatment and needs support. That's the key issue. So let's talk about mental health in North Dakota. About a quarter of our adult citizens in North Dakota are going to have a mental health or substance use diagnosis. In 2016, it was estimated that 30% of North Dakotans engage in problematic drinking behavior. That's about third in the US. We're usually up toward the top. In 2015, 137 North Dakotans died by suicide. Disturbingly, it's the second leading cause of death in the 10 to 24-year-old age group in North Dakota. That really bothers me. It's very upsetting. But here's the take home, and I'm going to walk you through it. From 1999 to 2016, a bunch of different federal data suggests that North Dakota has the largest increase of all states in the US of death by suicide. 57% increase in that short time span. Why? What's that about? And it's not just North Dakota. This is the study that actually, where we got that data. And what you can see here is, take a look, this is a map of the US. If it's blue or gray, it means there was an increase in that time span over completed suicide. The only state in the country that didn't have an increase was Nevada, and I can't explain that. But the dark blue in the northern plains is very important for us to kind of wonder what's happening up here. And it's Minnesota, North Dakota, South Dakota, Montana, Wyoming, Idaho, and a few others. And I'll show you some other information in a minute that makes an important point, but we have to realize, and this is suicide, which is obviously a big deal. It's kind of the end point for people like me. But people that are thinking about committing suicide have a bundle of psychological and psychiatric problems. That's the point. It's a marker for mental health. I just want to show this very briefly. I wouldn't make too much of it. This is children's data from North Dakota in something that our teenagers fill out every year, the Youth Risk Behavior Survey. And what you have here are 3 items from 2007 to about 2015, I think. And it's items asking, do you ever think about suicide? Have you ever tried it? You know, and and when I worked in the clinic, and I'm talking to a teenage kid, when they would be like this, I didn't think they were a real risk, usually. Unfortunately, some are. But the fact that they're even thinking about it more, or talking about it more, or talking to their friends about it more is very concerning to me. And you see that linear increase over time. And it is the second leading cause of death in this age group in the state of North Dakota. So, do we know we have a problem? I think we do. This is from the Center for Rural Health at the University of North Dakota, and this has been replicated multiple times. It's going into about 40 communities across North Dakota and saying, what are your greatest needs? And then they just basically get a profile of those that are listed as the top 3. And every year for the last 15 years that they do this, mental health and behavioral health, mental health is just typical mental health, behavioral health includes drug abuse of any kind, are the 2 top needs across these 40 communities. It doesn't change. So the communities know we have a problem. In some ways, they're asking for help, but we have this big resource problem. And it's in North Dakota, it's in Minnesota, it's in the central part of the United States. So if you look at this map, these are the percentage of counties in given regions across the US that have been designated as mental health shortage areas, and you do it by county. So if you look at that lighter blue right in the middle, that is the west, north, central part of the United States in this survey. And what you see is there 20% of the counties in that zone are mental health shortage areas. It is by far the highest in the United States. The brown area down by Texas, Oklahoma, down there, Arkansas, Louisiana, it's 14%. The rest of the country runs mental health shortage area statistics at around 1, 2, 3%. They've got mental health people in just about every county. You'll see in a second, I'll show you right now. In North Dakota, we have 5 counties that are not mental health shortage areas. And it's basically around Bismarck, Mandan, it's around Minot, Grand Forks, and Fargo. Everybody else is a mental health shortage area. If you have a psychotic episode up in that northwest corner of North Dakota, you don't have many people to turn to. The situation is no better in Minnesota. The metro area around Minneapolis is fully staffed, but up here in the northwest quadrant, it's hard to find a mental health professional when you need one. So, part of the reason I think that elevated risk of mental health problems and suicide and all that in the northern plains may be because, sure, we have kind of a tough environment, we have big expanses of geography, but we also don't have enough help. So let's talk a little bit about what are some of the struggles. This is a diagram from the American Psychiatric Association that talks about what are some of the challenges for delivering and providing comprehensive mental health care in a rural area. Acceptability, availability, and accessibility. So let me take a minute and just walk through each of those real quickly. Acceptability. This is where people wanted to talk at some point about social stigma. Social stigma around mental illness may contribute to a decision to seek care. I can't read this. 2006 study found that stigma concerns were greatest in communities 3,500 to 15,000. So smaller communities have greater concerns about what it means to be mentally ill and seek mental health care than more urban areas. Studies show that rural residents wait longer to seek mental health care and enter treatment with more serious symptoms than their urban counterparts. If that's true, if the major reason that our folks are not getting in and getting the care they need quickly is because they don't have enough providers and there's a huge stigma problem and they show up much worse than they need to, that's a serious problem. One of the things about mental health, you got to deal with it early. If you wait too long, it's much, much worse. Availability. I talked about the issue of the mental health shortage areas. It's largely a rural phenomenon. There's a few urban areas around the country where there are shortages, but it's mostly rural. Due to the shortage of behavioral health specialists, primary care providers in rural settings often play a large role in the delivery of behavioral health services, but they may not have the knowledge, competency, or comfort to assess, treat, and manage behavioral health challenges. My friends who are primary care providers, they're delivering babies, they're taking care of ear infections, they're taking care of sore knees, and then they're taking care of a psychotic person who's depressed who wants to kill themselves. How much time are they going to have for that person? In a busy schedule, a busy clinic, it's a limitation. Accessibility. Individuals with mental health problems who live in geographically dispersed areas have limited access to mental health services due to transportation barriers. There's good evidence that if you aren't within 150 miles of a mental health provider, you're less likely to seek help. So we have limited public transit like they have in New York City. You hop on a subway, you get to somebody. It's not easy here. I once treated a young woman from the Williston area who came to Fargo, saw us in the eating disorder clinic. We set up a treatment plan. We talked to her husband, and he said, I don't want to put her in the hospital yet. We said, okay, we'll need to see her 2 to 3 times a week from Williston. It's a problem. The weather is an issue, obviously, and then just getting to and from clinic settings is a huge issue. Limited or absent broadband connectivity. We'll talk about telehealth. North Dakota is not too bad, but telehealth is the future for a lot of mental health. And if we don't have good connectivity to everybody in every county in North Dakota and Minnesota, we're limited. So what are a few things that we could at least think about, and maybe this will lead to a little bit of a discussion about what we can do. Integrate behavioral health and primary care more fully. Get mental health professionals in primary care offices anywhere you can. In person is great, so you've got a social worker, a psychologist, a psychiatrist, a counselor, somebody in that primary care clinic, so that that family doc can say, I think this person's depressed. Could you see him, assess it, figure out what to do? That's important. That's the model that I think could be helpful. We aren't there yet. Leverage telehealth. Telemedicine benefits for rural patients include reducing their transportation barriers. That right there increases the likelihood that they're going to follow through on their appointments. Because they can do it, they can go to the primary care clinic in their community. We can do it in their homes. So telehealth, I think, is a huge factor, and mental health is one of the things we can do well with telehealth technology. Things like dermatology, maybe a little more complicated, but not impossible. But mental health is something we can do. Grow our own behavioral workforce. For me, this is, I think, the biggest obstacle. We got to get more people. We got to educate them. We got to help train them in the clinical environment. We got to help them get into a job, and then we got to help them stay there. We don't have enough people to do the work that we need to do. The lament of the rural towns, we have to send them away to get them trained, and then we run the risk they won't come back. We hear it all the time. So we got to figure out how to use our local colleges and universities to help us train up this workforce. Increase collaboration with community partners to focus on prevention and recovery. The faith community obviously is a big component to this. We're interacting with them all the time. People have faith lives, and it affects and is influenced by their mental health. Schools. If we could deliver some mental health care to schools, to kids in schools, it would be a game changer. And we tried to do this. We set up a pilot. We thought it through. It looked pretty good. And the main obstacle was getting enough staff to manage it. But we did it in Fargo, and we did it in Moorhead. The day will come where we can do it again, but we need more people in place. Law enforcement and first responders, it's automatic. Take a little time and talk to cops about what's going on in their lives in terms of mental health issues they see and what it does to their mental health. It's very important. And then lastly, place to work. I know a lot of people here are in the business world, and there is a whole movement afoot. And I'm not an expert about this, but I did a quick PubMed search a couple weeks ago to kind of see where we're at in terms of actually delivering mental health care in business environments. So clinicians going to the business, getting a space, treating patients, or the business letting people get an hour or something off so they can go to the clinic and get health care. Both models are in place. They're doing it all over the world. The interesting thing about these studies, and I would hope of relevance to you, is not only do these studies look at clinical outcomes, do they get better, but they also look at absenteeism, productivity, and cost to the business. Does it help? If you can provide support to your employees, is it good not only for them, but for the business? I'm going to be honest. The answer is, I think it's a work in progress. The programs that I looked at work clinically. They're still trying to figure out the economics and how much benefit actually comes from doing it in that model. we'll know more. I think this review is one that I can send it to you if you want, but it's very interesting to think about and relevant to our conversation. So with that, I will stop and invite my colleagues to the, whatever this is, platform. You want this?
Thank you, Dr. Wunderlich. That was a fantastic transition into our panel discussion this morning. And I'm supposed to say before I bring them up, but they're already up here, so skip that part. If you want to ask this morning's panel a question, please send questions directly to Dr. Glasner by scanning the QR code on your tables or searching chamberquestions.com in your web browser. We ask that all questions be relevant to the conversation and respectful. Joining us this morning is Joni Mendenwald from the Village Family Service Center, Michelle Parkinson from Prairie St. John's, and Dr. Greg Glasner from Blue Cross and Blue Shield, who will be the moderator of our conversation this morning.
Well, good morning and thank you. First of all, I'd like to thank Sean for that introduction and thank Xcel Energy for their continued support of the Eggs and Issues series. I'd like to really thank Dr. Wunderlich, who really trumped a whole bunch of our questions, just in case you didn't know. That's a very informative talk. We want to thank him for doing that. Now, today we're lucky we have a great panel. We're going to discuss a number of issues. We have a whole bunch of questions. We're not going to get through all these questions, by the way. Probably 6 pages worth of questions, but you know, there's a theme that's going to occur: shortages, stigma, workplace impacts, and then what can we do collectively to try to improve the outcomes for everybody that we take care of in this area. So to kick off the panel, we'll ask each of our panelists to give just a 30-second intro of themselves, and I'll start because I suppose I'm on the panel as well. But so I'm Greg Glasner. I'm the Chief Medical Officer at Blue Cross and Blue Shield of North Dakota. I've been in my role for about 3 to 4 years. Prior to that, I was at Essentia Health for 25 years as a practicing physician, and then as administrator. So next.
Good morning, everyone. I'm Joni Maidenwald. I work at the Village Family Service Center as a division director. I'm also a therapist. I've been practicing therapy for over 15 years. I have a specialty with early childhood mental health. And I am really excited to be here today and to continue this conversation.
Hi, everybody. I'm Michelle Parkinson. I'm the Group HR Director at Prairie St. John's. I've been there 13 years. I've always worked in healthcare and in human resources, so I'm excited also to be here to share with you just some of the things that we've seen on the HR side related to business and mental health.
And I'm Steve Wunderlich. I worked at the University of North Dakota for 30 plus years. I also worked in Fargo Clinic, Merit Care, Sanford, clinically in the area of eating disorders during that time. And then about 5 years ago, a group of us who worked downtown at the old TNI complex in a place called the Neuropsychiatric Research Institute merged with Sanford, and now I'm a vice president for research in Sanford.
All right, thank you. Now, just to put this in a little context, we have a number of questions, but just from a financial impact from the Blue Cross and Blue Shield perspective, I pulled some stats. In 2020, just for 3 diagnoses, anxiety, just general behavioral health, and depression, 2020, the total dollar amount was a little over $33 million in claims that we paid. And then in 2022, that had gone up to just under $38 million. So very significant impact just for 3 diagnoses. There's a whole host of other diagnoses under the behavioral health world that really add to a significant increase in those dollar amounts, but we're talking material dollars that really impact every one of you that pay those premiums, and then the cost just to treat everybody. So we touched briefly on telehealth, and then in telehealth in 2020, there was just under $10 million of behavioral health claims from Blue Cross. That has gone down to just about $6 million as there's been a shift of moving people back into the clinics, and that's really a driver from both patient desire and then the clinics want to have face-to-face visits. But behavioral health is probably the one area where telehealth has continued to be a driver. because it's accessibility wherever you're at, and you don't have to leave your home, you don't have to go to the clinic to go to the behavioral health clinic, so it really addresses the stigma component of that. And so if there's one area of telemedicine that's really, I think, has a glimmer of hope for the future, it's in the behavioral health market. So I'll start with some questions. We've got about half an hour or so of questions, and I'm sure we could keep everybody here for not eggs and issues. We could have hamburgers and issues for lunch if we wanted to really keep going. So we'll just start off. So general mental and behavioral health issues. So it seems to be more common in society today. Dr. Wunderlich, we'll start with you. What are some of the causing factors you think for the increase in the behavioral health in today's society?
Yeah, it's a great question. There's kind of the longer term trends of why is there more depression, for example? Depression and anxiety are the real common ones. The most common psychiatric problem are anxiety disorders. And why are those on the rise? And then I'll make a brief comment, and then I'll talk about the pandemic. I think that if you just look at changes, people talk about changes in family structure, people talk about changes in our socio-cultural life, faster paced, more intense, more pressure. All of that, I think, contributes to this broad demographic increase. The gene pool is not changing. The biology of human beings is not changing over the last 50 years. But rates of depression, for example, are dramatically increasing. It has to be environmental. I think most people just think about we're creating a world that is full of pressure, risk of failure, and difficulty for success. And the brain doesn't respond well to that environment. So I think we have to think about the kind of world we're building in terms of its impact. The other thing I'd just say, and maybe we'll come back to this, I'll be very brief. The numbers I've seen, federal numbers, local numbers, in terms of changes in the mental health status of people in the 3 years of the pandemic is dramatic. My colleagues and I around the country touch base a lot about people seeking care. Wait lists that are 4 to 5 times longer than we had before the pandemic still exist. So I think that longer term and short term, one of the things we have to realize, the environment matters.
All right, thank you. You are killing my questions. No, I appreciate that. So Joni, what do you think the social impact of social media has on the behavioral health talks today?
Yeah, I think social media has had a really big impact. I think it can be both positive and negative. We often hear more about the negative. You know, social media offers us a view into many other people's lives that we wouldn't know anything about without that as a tool. Platforms continue to develop and become popular, and you know, we all have numerous ways to connect with one another. So that connection can be both positive and negative. I think that, you know, especially in our younger generation, people have found social media as a place of acceptance for some of the things that they're struggling with, or ways to connect with other people outside of their community. However, social media also can be at times quite toxic and really damaging to your mental health. And so it's just really important to monitor how you feel when you're accessing social media, and how you feel when you turn that app off and go about the rest of your day, and also what you're looking at or what your loved ones are looking at, and the amount of time that they're spending and the content that they're looking at, because it can be positive and a source of connection, but it can also really lead us to think that other people's real lives are what they put on social media, and we know that that's just not true.
All right, thank you. So we're going to try to touch the workplace because this is a chamber event. So Michelle, is it common to really see the impact of behavioral health in the workplace?
It depends. There are so many people that are very good at hiding what's going on in their mind, right? You have thoughts that are going on that you may not see. And I think sometimes you see that with suicide. It'll be a shock to their family and friends because they didn't know what that person was thinking. But on the other side, I think that there are things like maybe someone all of a sudden isn't dressed the way they normally would, or maybe they're kind of getting messy. Maybe there's someone that was really organized and all of a sudden they're not quite so organized. Their work quality decreases, things like that. Absenteeism, we talked about, and Dr. Wunderlich brought that up. People that normally, don't call out sick are calling out sick more. Maybe they're less productive. The CDC refers to that as presenteeism. So I'm present, but I'm not really doing the amount of work that I was doing before. And those are things that I think you need to watch for and really know your employees in order to know if something's going on.
Joni, are there other signs and symptoms that are common to look for in the workforce, just so employers can try to help identify individuals that need?
Yeah, I think Michelle hit a lot of them. Just any changes that you would see in a staff member, a colleague, an employee, an employer. Just those changes that are out of characteristic for the person, whether it is, coming into meetings a little bit late or, calling out sick more frequently, any of those, slips in their performance or mistakes that aren't typically made, just any of those things that seem a little bit out of character but are continuously happening. It might be a nice time to just try and have an open conversation to see how that person's doing.
We have some questions from either the audience or online, and I'll just go to one now for Dr. Wunderlich. So there's someone that says they have a teenage son who struggled with mental health issues, and he found that there's been some improvement with changing their nutrition status. Is there really a correlation between mental health and nutrition that you can comment on?
Yeah, it's actually a great question. I'd say broadly speaking, yeah, there is. I mean, nutrition affects the brain, brain affects behavior. So it makes good sense. If you can optimize what you're eating, it's probably going to optimize your brain functioning. On the other hand, if you go to the lists that we have to look at, what are the top tier treatments for depression, anxiety, any of these kind of problems, you're not likely to find change the diet, not yet. But this will be very quick. It's a little bit of an
Take your
interesting
time.
tangent.
We take
Yeah.
your time.
There is a whole world of research, and I think in the not too distant future, clinical work on the microbiome, so the inside of the gut and bacteria in the biome, and we have a lot of bacteria in our microbiome. And what we are finding increasingly is that the status of that bacterial arrangement has a huge impact on all sorts of health, but more recently it's starting to look like it impacts the brain more than we ever thought and is correlated with anxiety, depression, and a number of things, including obesity as well. So what we eat through pathways that we never imagined could actually influence our mental health. I think that's a little bit out there, but stay tuned. So I think that for whoever wrote the question about their son, I would stick with mainstream treatments that their providers are probably providing, but then also perhaps add some nutritional components. But don't give up on the mainstream treatments.
I would just add, too, that, I think sometimes other concerns can be presenting as mental health issues. For instance, when somebody maybe has an unmet sensory need or a sensory irritation, in kids we'll see it a lot, like refusing to brush their teeth or their hair or not wanting to shower. And we'll see that come into our clinic as, defiant or not listening and different things. And sometimes through our assessment, we can understand that maybe that's an unmet sensory need or that's not being addressed. And so we might refer over to OT for that. And we'll see that when that need is met, that behavior calms down. And so it wasn't really a rooted mental health issue, it was rooted somewhere else. And so we've also seen people, share with us that when they have done eliminations of a certain food or food group from their diet, they feel better. And so I think there's, a holistic approach that we have to take when looking at mental health and mental health concerns that can be, rooted in various places. And so that's why assessment is such an important part of the work that we do.
Great. Thanks. Since you have your mic warmed up, we'll just give you another question here.
Okay.
So we touched on telehealth. How has telehealth impacted your practice, and how do you think, or where do you think the future of telehealth goes with behavioral health?
Sure. So prior to the pandemic, mental health wasn't really known for doing telehealth services. As we're getting, post-pandemic, if we can say that, I think it is going to be, like Dr. Wunderlich shared, where we're going to go in the future. I don't think it's going away, and I think it definitely has its place. At the beginning of the pandemic, what we saw really were individuals not wanting to engage in telehealth. When they couldn't do an in-person session like they were used to, they just wanted to cancel and wait it out. And as time went on, that strategy just wasn't working. And so people did warm up to it that initially maybe were a bit hesitant to try telehealth services. And then it became quite normal for quite a few years. And on the provider side, there are definitely individuals that can be really successful doing telehealth services with their provider. As an early childhood therapist, it was challenging for me in a lot of different ways, trying to do trauma-based play therapy with a 2 or 3-year-old through a computer screen. And so there's instances where telehealth, I think, definitely reduces some of those barriers for individuals that maybe have mobility issues, transportation issues, weather-related struggles getting around. But in other instances, I do think that in-person work is still needed and still vital for certain types of services.
Sure. Back to the workplace question. Michelle, are there common HR policies that deal with behavioral health, and what are some opportunities for maybe members in the room to look to change some policies if they haven't done it?
Sure, a lot of research has been done on time off. And Joni and I were talking about that earlier, like how many companies offer mental health days as part of their time off piece. So really looking at your PTO and or vacation sick leave policies to see, just when can somebody take time off. I would encourage supervisors to be watchful of employees and maybe say, if someone's starting to struggle, hey, do you just need a day off? And just recognize that and encourage some of that usage. Behavioral health issues are considered a disability under the Americans with Disability Act. So according to that act, you have to engage in a dialogue with the individual and create reasonable accommodations. Some of those reasonable accommodations could be changing their work schedule, giving them time off to go to appointments. I think supporting their appointments is very important, and it does show that you genuinely care about that individual. It would also be considered part of family medical leave, so employees can take either intermittent time off or they could take longer blocks of time off, maybe if they were going to go to a partial hospitalization program or something like that.
Sure. Dr. Wunderlich, we talked about shortage of mental health providers. You addressed a couple opportunities, and there seems to be just a continuous shortage. In my practice, I practice medicine, I still practice medicine. At least 25% of the visits I see here have a behavioral health component to it, at least from the primary care piece of my OBGYN practice. Almost all of the primary care clinics, if you just set them up, they all ask for some behavioral health help in those clinics. And you talked about the integrated care model. Where do you think we're at with that in the state of North Dakota, having the integrative advanced primary care model?
I think we're talking about it, we're thinking about it. I don't think we're there yet. I think there's a multitude of ways to do it. You can try and integrate mental health into primary care through electronic medical records, which is not a bad way to do it. You can also use telehealth to pipe mental health experts into primary care providers' offices. There's something called Project Echo, and I don't know if any of you guys are doing it. It's a national program where basically you do collaborative care, but it also includes education. So if we were to do it in mental health, what we do is we would get a bunch of primary care providers, we'd get a bunch of mental health providers, we'd get them integrated through telehealth, and there would be trainings for the primary care staff provided by the mental health folks, but there'd also be consultations on their cases. I think there's models like that that are out there. I think the pandemic might be pushing us closer, but we got a ways to go.
Some of the stigma of mental health are lots of the reasons that individuals don't seek care. At Blue Cross, when we do our RFPs, we often encourage large businesses or small businesses to have a dedicated space for a telehealth room where people don't have to leave their business and go to the clinic. Where are you going? I'm going to my behavioral health visit. I'm going to go see my psychiatrist. Well, that stigma will stop people from going to get that care. So, Michelle, what do you see, or what do you think the community can do to reduce the stigma of some of the mental health issues?
Sure, I think that we need to talk more about it. Years ago, it's like leave work at work and home at home, and I think those things are intermingling now. And if you don't pay attention to everything that's going on in your employee's life, then you're not doing a good service to your employees. We're all struggling to fill the jobs that we have open, and we need to retain our staff. And in order to do that, I think we need to connect with them. And sometimes that means a difficult conversation about how are you doing? How are you really doing? How are you feeling about that? And I think that the more that we talk about it openly and suggest that maybe they need to take time off or to use your employee assistance program, right? So most employers, and if you don't have one, you should have an employee assistance program, because as the supervisor, you are not meant to be the therapist. That's way outside of your scope, and it will kind of blur the line between employer and employee. And that's why if you can refer over to a Village or whatever system you use, that too will also help with the stigma, because now I'm acknowledging that there are issues, right? We all have issues, but let's make some time and encourage those employees to get help.
Yes, Dr. Wendell.
One other thing I'd add is in the stigma world, there's this thing about contact versus non-contact interventions. And I didn't know what that meant. So I looked it up, and basically it means contact is when leaders or people of prominence basically say, yeah, I was depressed. And leaders in businesses acknowledge their own struggles. And it destigmatizes that community. So, in the building I'm in, I got to let people know, yeah, I had a depression when I was in my 20s. And this is how I dealt with it. So that it's not something that you got to, bury because they're going to think I'm weak or I'm ineffective. So I think that's another thing. We've seen it with like athletes and things like that recently. It's a start, but I think it could move a long ways down the ladder from, multi-million-dollar athletes to directors in various businesses around where people work for them, and just kind of acknowledge, yeah, I'm human too.
I think I would just add too, if you don't mind, is, it's just important to have these conversations and for people to be able to be honest, and as they were sharing, just sharing your own story, or if someone is sharing their story or their struggle with you, to just be understanding and to listen and to be warm as you're listening to them share, because it can be very difficult to do that. I do think social media has somewhat, well, maybe not social media, but we have seen more celebrities, more people that are, famous for different things coming out and sharing their stories. We saw a lot of that actually during the beginning of the pandemic, different commercials and different campaigns that came out that were solely focused on people that you see on the TV or the movie screens daily sharing about their journeys or sharing about their own struggles. And so I think we have movement towards destigmatization that has been, in my opinion, a positive outcome of the pandemic, because I don't think we'd be as far along now as we are without some of those campaigns and some of those people coming forward at that time and still today.
So, Joni, nobody wants to talk about COVID-19, but what do you see as the impacts of COVID-19 on behavioral health aside from just the social isolation?
Yeah, I think COVID was really challenging for a lot of reasons, and we all know that. we have seen, of course, an increase in need for mental health services as we're coming through this pandemic. What we saw locally and across North Dakota, Minnesota, was that a lot of our providers transitioned out of the field towards the middle or kind of end, year 1, year 2. As an employer, I saw some providers really struggling in the beginning of the pandemic. They were experiencing this trauma at the same time as their clients. So they were feeling anxious and trying to figure out the homeschooling with their kids and all of these things and their personal life. And then they come in to work for 8 or 10 hours, and that's exactly what they're trying to give to their clients as well, is to help them, support them through that. And so it was really nonstop exposure without any point of relief or distance for a lot of people. And so I saw some burnout initially then. For some providers that did okay in the beginning, once year 2 was coming around, they were, kind of hitting their maximum point as well. And so we saw individuals, providers asking to reduce down their time. I want to go part-time. Or we saw providers say, this pandemic has really shown me I need to be closer to my family. I'm going to leave and move back home closer to where my parents are. Or they had a loved one that was sick, and that caused them to need to step out of the workforce. We saw people really wanting full control over their schedules and over the clients that they were seeing and the payers that they were taking. And so they chose to go into private practice. We saw people take early retirements because of the burnout. And so we saw some of our providers stepping down, stepping away, stepping into different avenues, but then we also saw this increased need in our community, and we still are in a complete imbalance. And as it was talked about earlier by Dr. Wunderlich, getting through schooling to be able to serve and provide therapy is a long journey. And so we're in a space where wait times are probably much, much longer than we would want them to be because of some of the shortages and because of the demand that we've seen increase post-pandemic.
Thank you. A question for our audience, for Michelle. What is EAP and how does it work, and how can my business get involved? That's a great HR.
Sorry, I should not have used that acronym. Employee Assistance Program is an EAP. The Village has an EAP. A lot of organizations around here have that, but you can Google it. There's national companies. So if you have employees throughout the country, there are ways that they can connect with a therapist. And they offer more than just behavioral health services. There's all kinds of different things, budgeting and childcare and things. But I would Google Employee Assistance Program and you would see providers, but you got one in the room, so.
So EAP services are mainly wellness services, and so they're non-diagnostic, and they're usually free for a certain number of sessions through your employer. The Village does offer EAP services. We have different packages, but EAP can include individual therapy for you as the employee or any member of your family. It can include family therapy, couples therapy. It can include financial planning. It can include access to chemical dependency assessments or legal consultation, all free of charge as one of your benefits through your employer, just depending on what package your EAP looks like.
And the research actually suggests that maybe 5% of your employees actually take advantage of the benefit, but the return on investment is significant. And like I mentioned before, as a supervisor, you don't want to be their therapist. You're going to learn way too much personal information. So it's always good to have an unbiased person there to help coach them through whatever their needs are.
Okay, thank you. Well, there's some quick rapid response questions, and we'll just go down the line. We'll talk to Dr. Wunderlich. We have about 10 minutes to go here, and so I'm trying to time all this out. So I'm a first-time moderator, so bear with me here. So on a scale of 1 to 5, 1 being extremely inefficient and 5 being extremely effective, how would you rate the United States healthcare system effectiveness in addressing the mental and behavioral health crisis? Dr. Wunderlich.
2.5.
Michelle?
What was the scale again?
On a scale of 1 to 5, how would you rate the United States healthcare systems, and how effective is it in addressing the mental and behavioral health crisis?
Yeah, I would have to agree. It's probably 2. It's not great.
Joni?
Low, I would say 2.
Okay. So now shifting from the national level to more local, how would you rate our community's effectiveness, and we'll start with Joni on this one, in communicating mental and behavioral health resources to the public?
I would say maybe a 3. I think we've definitely made progress forward. There's a lot of different, maybe not a lot, but there's some really good work groups and different projects that are happening in our community to raise awareness, to get education out, really focusing a lot on suicide prevention in our youth and in our teens. And so I think we've done a great job of bringing together our providers to work more as one instead of everyone kind of doing their own thing. And so I think we're doing pretty good in that area.
I would say a 4, but we really lack the resources, right? We need more therapists, we need more psychiatrists in order to really handle the need that's out there.
Dr. Wunderlich?
3, we've got, I think, a number of really excellent clinical silos in our community, but I think they're still largely silos, and I think we just need to build some bridges.
That leads to one of these other quick response questions. What overall challenges, and you say silos, what are the other challenges to addressing the crisis in North Dakota?
Workforce.
Yeah.
Workforce, okay.
Workforce.
And all of you are saying the same thing in your industry.
Yeah, and they're in everybody's industry. Okay, we'll start. Joni, if you have to leave the audience with one thing from today's conversation, what would that be?
Just to continue to uplift mental health and to talk about it, to not be afraid to talk about it, to share your story if you're able to do that, or to be someone that others can listen to. I mean, I think just the more we talk about things, I think the healthier we can become as a community.
Michelle?
From the employer standpoint, I would say watch your employees, listen to your employees, encourage self-help, and encourage them to talk more about what's going on and not stay into themselves.
Building on this, I think just that if you have an employee or a colleague who's struggling with mental health issues that interfere with their work, it's a problem that can be fixed, but somebody's got to detect it and then do something about it. So.
Okay, we'll start with Michelle. What are the first step a business can do to address mental health crisis in the workplace? First steps.
Right, so talk to your employees. If everybody is focused on employee mental health, even their coworkers, if we just talk about it and be supportive, part of retaining employees is your culture. And part of the culture is caring, right? And a lot of employees are looking for a caring environment, and this is one piece of it.
So twisting that a little bit, because I'm sure the two providers don't necessarily see the business, they see the result of that. So what are the first steps you think an individual needs from a business to deal with the behavioral health issues?
I guess just probably feeling safe to talk about it or to ask, who's our EAP provider? What services, are available? Is it okay if I come in early so I can leave a little bit early and make it to an appointment? Just providing an environment, again, coming back to your work culture where it's safe and it's okay to talk about that or to ask for an accommodation if you need one.
Dr. Wunderlich, anything to add?
I don't think so. I think those sound like great ideas.
So we have another question here from the audience, and there are a lot of them that have come through, and I haven't been able to get to very many. We'll just start with Joni. What is a peer support specialist, and what are they, and how are they being used?
So this is something that's kind of newer in the field. I'm not fully familiar with it, but my understanding is certified peer specialists are individuals who have experienced a mental health concern or a chemical dependency concern and have come through that and then have done some training so that they can be a peer support to an individual who's also experiencing something like that versus, a professional support. So it can be in conjunction with professional supports. That's my understanding. I don't know.
Yes, that's
Okay.
correct. I think they're primarily focused on addiction.
I think that, yes, I think there are some, I've seen some with individuals on the autism spectrum having peer supports as part of their team. But yeah, it's kind of newer.
There's a question that keeps popping to the top of the board, and I kind of been dodging it because I'm not sure I want to say the wrong answer, but a common barrier. The question is, a common barrier for individuals is insurance coverage on visits. Them plans often, they limit the number of visits someone can have for behavioral health visits. So there's a thing called mental health parity that's greatly reduced those barriers for access to mental health visits. And so the Mental Health Parity Act is really one that says that you have to treat behavioral health issues or mental health issues the same as if you would treat a non-behavioral health issue, so that you can't really limit the number of services and number of visits. Those restrictions are greatly reduced. So the opportunity is there for people to get the care they need, and you can, like Dr. Wendlick said, these are treatable conditions. We have to accept that they're real and that they're really impactful in our lives, and that there are resources out there, even though right now access to resources are probably the rate limiting step for the greater part of North Dakota. There's a final question here, and that we'll just go through each person, and we'll start with Dr. Wendlick. How can folks in the room help address the mental health crisis? How can these chamber members help address the crisis?
Make it something that we all recognize is a real thing, is a problem that needs to be acknowledged.
Michelle?
I'll go back to culture and caring about your employees and paying attention to them.
The only thing I would add, and this is kind of a different angle on it, but just encouraging people to come into the field. We need, I've been working on a couple projects in our community to recruit more people, and we know the high school level is probably our best level because when people enter college or trade schools, they kind of have an idea what they want to do. And so if you have anyone in your life that you think would be a great fit or would ever have any questions, encourage them to look into it or to reach out and ask someone some questions.
Excellent. All right, I think we're getting close to our time. So I'd like to thank our panelists, Dr. Wendlick, Joni Mendenwald, and Michelle Parkinson, for your time and your leadership in the community and your dedication towards the mental health of the fields. We really appreciate it and really value your contributions. A quick reminder on some upcoming events. Please take a look at the slide down here is not the slide up there, but there will be a State of the Cities on January 19th, followed by the Midwest Economic Summit on Wednesday, February 8th, and then another Eggs and Issues on Thursday, February 23rd. So please register for these events through the Chamber website. Thank you everyone for attending, and please enjoy the rest of your day. Happy New Year.